Good afternoon to all. Kindly resume back to the seminar. We are now pleased to introduce our next speaker. Good afternoon to all. Kindly resume back to the seminar. We are now pleased to introduce our next speaker. Good afternoon to all. Kindly resume back to the seminar. We are now pleased to introduce our next speaker. Good afternoon to all. Kindly resume back to the seminar.
Yes, we are ready, and so
Sorry for our technical
yes, we are ready.
Sorry for the technical issue. We are now pleased to introduce our next speaker, Dr. Bessie Paul, a registered psychiatric nurse from National Forensic Mental Health Services in Dublin, Ireland. She completed her bachelor's degree in the nursing and postgraduate. We are now pleased to introduce our next speaker, Dr. Bessie Paul, a registered psychiatric nurse from National Forensic Mental Health Services in Dublin, Ireland. She completed Sorry for the technical disturbance. We are now pleased to introduce our next speaker, Dr. Bessie Paul, a registered psychiatric nurse from National Forensic Mental Health Services in Dublin, Ireland. She completed her bachelor's degree in nursing and postgraduation from Manipal University, Manipal. She completed her PhD in mental health nursing from National Consortium by INC and affiliated to Rajiv Gandhi University, Bangalore. She has finished a variety of certificate programs, including certificate program in young adults, guidance and counseling from KUHAS, certificate program in management from Manipal Institute of Management, Manipal. She recently awarded as membership of Faculty of Nursing and Midwifery by Royal College of Surgeons, Ireland. She has nearly 10 years of teaching experience and 5 years of clinical practice. She has many publications in peer-reviewed journal. Currently, she is working as enhanced mental health nurse in National Forensic Mental Health Services, Portray, and pursuing graduate certificate in health professional education from University College, Dublin. I am happy to announce that she was a former employee of Carmel College of Nursing. So our next speaker is Dr. Bessie Paul, will be addressing the crucial topic of mental health during a catastrophe.
Good afternoon. Good afternoon, everybody. Am I audible? Can we start the session? First of all, before starting the session, let me express my sincere gratitude to the college and management for calling me for this presentation. I'm very grateful to the college and its management for all the help and support they have offered me when I was working in there. I worked there nearly for 5 years, which is a good enough part of my whole experience in nursing. So let's go on to the topic. Is the slide visible to you all? Can anyone please tell me an yes or no?
Yes, it is visible, Bessie.
All right, okay. So the topic that we're going to deal today is disaster psychiatry. I'm getting actually into the actual theme of this year. WHO has wisely selected a title for this year's Addressing the Catastrophes. So the topic is mental health during catastrophes or disasters. So what do you mean by a disaster? A disaster is a catastrophic event, often sudden, that causes widespread, serious harm to people, the environment, infrastructure, and it exceeds the capacity of the affected community to recover on its own and necessitating an external help. Every community, so if you think about the year 2025, globally, we have been facing a lot of catastrophic events. And these events are well beyond the community's ability to cope over the catastrophic incident. And the disasters can be categorized into 3 types. So one is a natural disaster or a catastrophe like earthquakes or floods, man-made disasters like wars, or technical disasters like chemical spills. So coming to the context of this year's theme, let's have a look at the global incidents this year. The first and the foremost thing to talk about is the Sudanese civil war, which is known to be one of the world's largest humanitarian crises. So this is an internal political unrest that has been persisting in the country for last few years, which has displaced a huge lot of their population. So the fight is actually between 2 different political sections within the country, and considering the economical background and the setup of the country, and when there is a kind of unrest, so that has hit the country badly. So that is one of the major catastrophes of this year. I'm not going to look at everything. I'm just having a glance just to reflect to you what is the importance of this topic in this year. So coming to the next one is the Russia-Ukraine war. So we have been hearing about it for a while now. There was a major hit in March, and going forward, there has been multiple attacks here and there, and the community has been suffering a lot. And then the next one is the Gaza war, the Israel-Palestine war, which has been going on now. So that is another one which is affecting the whole globe. Okay. And you know, the protest is worldwide. People are going as refugees to different countries. The country in which I'm staying, Ireland, is still welcoming a lot of refugees, which again brings in a lot of mental health trouble for people moving over to different countries, adapting to different cultures, adapting to different languages. So these are all affecting the mental health globally. And the next one is a Myanmarese civil war, and at the same time, they had a huge earthquake in Myanmar this year, taking lives of more than 3,000 people. Okay, so these are the major catastrophes worldwide. It is just a glance of what has been going on. And in this context, what is the importance of mental health and how are we going to reach out to these people? What are the problems that these communities are facing and how we are going to address it? That is what is the focus of this year's theme of World Mental Health Day. Both the World Federation of Mental Health and WHO both are focused on mental health during catastrophes. So now coming to the impact of these catastrophes. We know it's a war, we know it's an earthquake or any kind of other industrial accidents or whatever it is. So it is going to hit a huge geographical area and a large number of population. So it is not an easy thing to manage because the existing healthcare system will have its own loads to manage. Coming to our own country, we recently had a war with Pakistan. God's grace, it didn't last for long. It has been kind of resolved. So still, when a country like ours is hit by a war or hit by any kind of these calamities, the existing healthcare system has to cover a huge geographical area, a huge population, and the economic status of the country. That also depends a lot on how we are going to deal with these things. So these kind of calamities can have impact on different realms. So we can have a look at the social problems in the first slide here. So what could be the social problems that these countries will experience while exposed to these kind of catastrophes or disasters? So the first and the foremost thing is these kind of catastrophes or disasters can worsen the pre-existing social conditions, including poverty, discrimination against marginalized groups. See, the way Sudan is suffering would be different from the way Ukraine is suffering, and it could be different from the way Palestine is suffering. It all depends on what they had in hand just before the disaster hit them. Okay, so the next one is emergency-induced social problems, which include family separation. As I've told you, there are loads of people leaving their own accommodation, moving to various places, trying to find a place for them to stay, to manage their livelihood. So that could be a different country too, because a lot of the supporting agencies would be coming in place. A lot of NGOs would be coming forward to help this population. Lots of countries would be coming forward to help them. People would be displaced to different countries. And then lack of safety. Just imagine a day you get up in the morning and you can see the hear of bomb shells and the buildings getting destroyed, and you can see dead bodies all around you. The way you feel unsafe in such kind of environment. You can just have a look at the picture there. These are 20 popular pictures of the Gaza war, which I got downloaded from the internet. So you can see the way people are suffering. That's a little girl. She's sitting inside a van watching outside. You can see the little drawings that she has on the screen there. And again, you can see a family being separated, a father and a child being separated. He is trying to safeguard at least the child. That kind of trauma that people are going through is immense. And their loss of livelihoods and disrupted social networks, low trust, and reduced resources. So these could be the emergency-induced social problems that a disaster or a catastrophe can bring in. Hope the slide is moving. Okay, so coming to the social problems. So these are the humanitarian response induced problems. So this includes overcrowding, lack of privacy, and undermining of community support. So, when you moved into, we had a very good example of a flood which had happened in Kerala in 2018. And most of us from the nursing colleges were kind of involved in the support in community. And the crowd might even have some people who have actually experienced it in their own lives. The way they move to shelter places where there are lots of people coming in. So they had their own troubles in getting on with in such circumstances. So that could be the social problems in gist, which could be caused by a disaster or a catastrophe. Now coming to the mental health problems. So coming to the mental health problems, a catastrophe can worsen a pre-existing mental health condition, such as depression, schizophrenia, or harmful use of alcohol and other substances. Mental health, when we consider the biopsychosocial model, a mental health issue or any healthcare issue comes in when there is a combination of all these factors. So a disaster itself is a stressful event which has implication in all these realms. And once a person is being exposed to such an incident or an event, so that itself can contribute to worsening of existing mental health problems. Upon that, there could be shortage of medical facilities, difficulty in accessing mental health services, getting their treatment on right time, getting the resources needed. So all these could again contribute to worsening of existing mental health conditions. And coming to the emergency induced impact on the mental health could be grief reactions, acute stress reactions, harmful use of substances, depression, anxiety, and post-traumatic stress disorder. And when you consider the humanitarian response, this again can induce anxiety from a lack of information about how to get food or access to basic services, especially in the intensive active phase of it. When people are coming, trying to help them, they might not know where to go get food, where to go get their medical help, and what to do, whom to approach. Everything would be unclear to them, which could be adding a lot of stress to people. So these are the mental health impact of catastrophes. And now coming to problems in obtaining mental health services. So pre-existing limited access to quality and affordable mental health care. So we know that all the countries would not be equally equipped. They might have their own limitations in offering mental health services to their entire population. So upon that, when there is an emergency or a catastrophe which is hitting in, and then lots of people being affected, the load on the healthcare system is increasing heavily. And with the resources available to them, that would be difficult for them to manage it. So that is worsening of the pre-existing conditions, or it worsens the pre-existing access to quality and affordable mental health care. And then coming to the emergency induced impact, which include damage to facilities, staff shortages, disrupted medicine supply chains, and surges in demand that overwhelm existing infrastructure. So we know that when there is a war, we are frontline workers to go in and help the casualties, help to evacuate people, help to offer, ready to offer the immediate help and support to them. So we are equally vulnerable as the affected population. And that could claim on our lives, that could claim on our energy, that could claim on our mental health as well. So these things are the emergency induced effect on the mental health services. And coming to the humanitarian response induced problems, including lack of coordination, and insufficient training for emergency responders. So this is not a planned thing which is happening. It happens all on a sudden, and we are trying to plan, we are trying to organize so that the service is delivered in the best and in a quality way. But still, because of time constraints, because of staff shortages, there could be problems in actual carrying out of these interventions. So when there is a lack of coordination, the same way as I explained in the previous slide, we wouldn't be sometimes able to give appropriate information to people when it is required, and there could be other problems as well. So these are the general impacts of a disaster or catastrophe on a country or on the affected populations. So we have explained its effect on the social situation, social circumstances, mental health problems, and the mental health services. So this is what we generally find when we read upon it. Let's have a little look into the literature. So just focusing on what has been going on Sudan. So there is a journal article here which actually explain the impact that the disaster actually had on the existing mental health problems there. So we can see that the access to mental health care has become alarmingly scarce in Sudan. Since the conflict began, at least 67% of the hospitals in conflict zones have ceased operations. So we can just imagine 67%. It's not a very minimal amount. It's a huge part of their healthcare sector has failed to work, failed to function in an emergency. And then they had shortage of qualified medical professionals. And here we can see 13% of secondary school students are affected by depression and anxiety. And coming to pregnant women, another vulnerable group. So we can see that a staggering 23% were diagnosed with prenatal mental disorders across primary care facilities and communities within Sudan capital. And the internally displaced population exhibited even more distressing picture, with overwhelming 53% suffering from mental disorders, including major depressive disorders, generalized anxiety disorders, social phobia, and PTSD. And the prevalence of severe mental health disorders among internally displaced individuals pegged at 1.5%. So that is a little picture about Sudan. Now coming to Ukraine. In 2022, there were 707 attacks on Ukrainian healthcare facilities, and 218 hospitals and clinics were damaged or destroyed, and 181 attacks on their medical infrastructure facilities, including pharmacy and dentistry. That is the documented damage that was reported in 2022. The damage caused by the aggression to healthcare system of Ukraine was $26 billion. So you can imagine the trouble that the government had in managing all this. The local healthcare system had in managing these troubles when their loads has increased significantly. Okay, and during the year, there were 86 known attacks on healthcare workers, with 62 healthcare workers killed. And the most frequently mentioned obstacle in accessing mental health care services has been cost, but also availability and long lines at local pharmacies. And in the first month of full-scale invasion, more than 2,000 people on opioid substitution therapy were at risk of treatment interruption. So we can imagine the impact these changes would have had on the mental health of the country. And again, there is another study which evaluated the effect of this war on Ukraine and 11 other neighboring countries. Here we can see people from the affected country reported the worst mental health indices, and the war-related variables were found to be associated with worse mental health. So they focused mainly on two things, PTSD and complicated PTSD. You know, PTSD is post-traumatic stress disorder, and complicated post-traumatic stress disorder. And the predictors were previous mental health disorder. So that means those who had existing mental health disorders, anxiety and perceived stress, whereas unique. So these are the major predictors. And coming to the unique predictors, there are some other predictors other than the existing mental health conditions, which included female gender and the impact of news on mental health. And for the CPTSD, it was being single and overall impact of war on mental health and some of lifetime traumatic experience and resilience had an inverse relationship. So if the person had good resilience, then it had a positive impact. Okay, and depression. So these are the factors that they have identified to have impact on the mental health issues. So that is some literature to support what I have been talking to you about the impact of disasters on mental health. Hope that is clear to you so far. Now coming to coping strategies. So how do we respond to a catastrophe or a disaster? So when you look at it, you can see that when a person is exposed to a catastrophic event, the person goes through 4 different phases. The first one is heroic phase, and the second one is a relief phase, disillusionment phase, and restoration phase. Generally, when you look at a community that is being exposed to a disaster, every individual or the community would be going through all these stages. So the heroic phase is the first week, usually during the first week after the disaster has hit the community. So people would be like taking an altruistic stand. They would be going forward to help each other to find places to hide, places to protect their family, trying to help each other to get necessary help and support. So that is the heroic phase, which will last for about 1 week. So that is just before all the outside help started coming into picture. So the relief phase is when actually the outside help, the external help is kicking in. So if you think about all these wars, you know that lots of NGOs and lots of other countries are supporting these affected communities, isn't it? Whenever there is a disaster, other countries, the UN, everybody comes into picture. They tries to help. Lots of NGOs are coming forward to help those communities. So in that phase, the community feels a relief. So they feels that they are being helped. The relief phase is otherwise called as a honeymoon phase. So they just start focusing more on the positive things. They feel that they are being supported, we are taken care of. So that can go up to around 2 to 8 weeks. So that is a kind of relief phase for the community, we can say. Though they have experienced the loss, they would be starting to look on to the help that they are getting. They would be starting to look back to their life, trying to restore their normal life to a bit. But then once this short duration is gone, then comes the phase of reality. So they are put back to the actual situation where they have to deal with all these things on their own. So this is what is called as a disillusionment phase. So here people are looking back into their own situation. So there is no much additional support and help available in this time. So they will have limited resources there. So the external help and support has significantly reduced. They might not have enough of supply coming in. There could be a worsening of the existing shortages and stuff. So people would find it difficult to manage this particular duration, and it can go from 3 to 36 months. And as health professionals, as mental health professionals, we should focus more on this particular phase, just because this would be the place where people would be needing more help and support. So up till the relief phase or the honeymoon phase, they were a kind of being supported. But at this phase, they are on their own. They have to try to rebuild themselves as a community. They have to rebuild themselves as an individual, and they have to manage their own livelihood. They have to find means for each and everything around them. So that is the disillusionment phase. And going on, once the community has adjusted to the disillusionment phase, that is when they move into the restoration phase, or where the community is trying to come back to the normal. So just for us to relate more, like as we have participants more from India, more from Kerala, we can just imagine how we have coped with the 2018 flood, with all those devastating loss that the communities had. And then with the government aids, with whatever supports available, our community has very well tried to come back to normal. So that is the restoration phase. So in that phase, our goal should be to continue support and help them to come back to normal. Okay, so these are the 4 phases that any community be going through in the face of a catastrophe or a disaster. Now, let us see the common human reactions to catastrophes, which as nurses, mental health nurses, we would be focusing on. So generally, when an individual is exposed to a catastrophe or a disaster, so they will experience numbness. They might go through an initial phase of denial or shock. They will experience confusion. They might feel stunned or overwhelmed, and they might feel anxious. They might have grief reactions to loss. They might have flashbacks and nightmares. They might experience anger, despair, sadness, hopelessness. These are the negative reactions or the negative emotions that we experience. At the same time, we can also see positive reactions in all these dimensions, which could be an inspiration to help others and rebuild relief and gratitude. So we can just recollect what has happened in the 2018 flood. We could see every stream of people coming into scene. Is it? We could even see the fishermen coming in and helping the entire affected areas. So they were coming out, they were volunteering to come out and help each other. They were ready to help people to rebuild. They were ready to offer relief assistance, and people who are helped might also experience a feeling of gratitude to those people who helped and supported them. So these are the common human reactions that an individual or a community might experience when they are exposed to a catastrophe or a disaster. And now coming to grief reaction, which is a very common and the most normal reaction that can occur when somebody is exposed to these kind of catastrophes. So what do you mean by a grief reaction? A grief reaction is a natural response to these kind of catastrophes, and its intensity is directly proportional to the severity, duration, and intensity of exposure to the disaster. Okay, and grief process occurs through various stages and are often experienced in waves or cycles or episodes with periods of intense and painful emotions. And usually, normal grief follows the above phases with possibility of some variations and resolves over a period of few months. So we know all the things, the Kubler-Ross theory of grief reactions and all that. So I'm not going to go deep into it because it's just only a 1-hour session. So normal grief reactions up to 6 months, we say that is okay to have a normal grief reaction. People would be crying, They might experience nightmares. They might go through emotionally overwhelming situations. So here what you have to do is, as health professionals, we have to encourage them to express their emotions, openly express the emotions, despite of hiding them, despite of suppressing them. We should help them to channelize it. We should give them more opportunities to talk about it. We should be empathetic to listen to them. So that is a normal reaction to a catastrophe, which is called as a grief reaction. Now coming to the abnormal reactions, where you can just explain abnormal grief reactions. The first one of abnormal grief reaction is a chronic grief, where the grief persists for more than expected duration of time. And then the absent grief, where people try to suppress these feelings and end up in further difficulties. And delayed grief, usually immediately following the event incident, people experience grief. Is it usually like, just example, grief can occur to any loss also. So for example, if you imagine a loss of a family member, and soon after the person has passed away, or soon there is what you can say, there is a gap that you can experience in your family, immediately you start responding to it. But in some people, this grief reaction could be delayed. That might not happen immediately, but can happen at any later point in their life. So that is called as a delayed grief reaction. And again, there could be distorted grief reaction, where the presentation would be completely atypical. Instead of crying and sitting and expressing their emotions in that way, people could be expressing it in a kind of violent, aggressive manner. So that is called as a distorted grief, where there is a totally atypical presentation of grief reaction. So that is an abnormal reaction to catastrophes, that is abnormal grief reactions. So that is the abnormal reactions. Now coming to the coping strategies. And when the community tries to cope with all these things, they can end up in some kind of mental health disorders. And here you can see from literature the common mental health disorders that adults might experience as they are exposed to disasters or catastrophes. So the first one is relapse of any pre-existing psychiatric disorders. As I've mentioned earlier, once we are going through these troubles, but the community might have difficulty in accessing mental health. They might not be getting timely help, timely medications, so that can worsen their existing mental health condition. And at the same time, stress itself, the overwhelming stress that the person is going through, could also result in worsening of the pre-existing mental health conditions. And they might experience adjustment disorders, abnormal grief and anxiety disorders like panic disorders, phobic disorders. Not otherwise specified. Okay, noise is not otherwise specified. Non-specific anxiety symptoms and startle response, acute stress reactions, insomnia, depression or death wishes or suicidal ideas or attempts, substance abuse, and dependence. In all these things could also result from a survivor guilt. You might have heard about this term. The survivor guilt is, see, you were somehow saved from the catastrophe, and you might be thinking, oh my God, I couldn't help my family. I am not a good enough person. I couldn't help my child. I couldn't help my parents. I lost everyone, and then I'm still alive. Why could I did not try to help them? So that kind of thoughts that can lead to depression and the suicidal thoughts and all these things. Okay, and again, there could be worsening of substance use and dependence, and even the monetary relief which is given to them could be very well misused in using these kind of substances. And then again, post-traumatic stress disorder, which is very common. Even in our clinical settings here, we get kind of refugee people coming in and expressing the symptoms of post-traumatic stress disorder. I even remember a patient who was in my service, in my last service. So that person was a victim of the Iraq war, and years after, still he is suffering with the same mental health impacts and repercussions. Okay, so PTSD is very common. And then again, non-specific somatic symptoms such as dizziness, headache, body ache, recollection of disaster, events through images and thoughts, nightmares, night terrors, and so forth, which is very well go in line with the symptoms of post-traumatic stress disorder again. And people can end up in other anxiety disorders like dissociative disorders and somatoform disorders. So these are the common mental health disorders that adults might experience after exposure to a disaster or a catastrophe. Now we can focus on the most vulnerable population, children. You would have seen some of the pictures there, which I've just displayed to reflect on the impact that this kind of incident has on them. So what could be the trouble that these children might go through? So they might experience non-specific symptoms such as dizziness, vertigo, startle response, disturbance in sleep-wake cycle. They might show clinging behaviors, because just imagine that the stress that they are going through. What are they seeing? Bombs coming in, or in case of a flood, people losing their lives in front of them, losing their home, right? So they might have lost their own parents or guardians. So they might experience a clinging behavior. They might keep sticking on to their surviving parents or caregivers just to make sure that they are safe and they're not going to lose them again. Is it so excessive crying? They might experience withdrawal, like they might be withdrawn to themselves, not interacting with others. They might experience fear, anger, irritability. They might experience emotional numbness, food refusal, decreased appetite, and they might even show some regressive behaviors. They might go back to their previous stage of development, right? As children grow, they gain more abilities, they gain more skills. But with these kind of things, there are high chances that they regress back to their previous stage of development, and they might need a lot of additional support. And then there could also be school refusal, school dropout, and academic decline. In a war, in a flood, schools are not spared. Is it so? Everything would be lost, and they might be affected with loss of education and stuff. And then anxiety disorders like panic disorders, phobic disorders, not otherwise specified, non-specific anxiety symptoms, and so forth. Oppositional defiant disorders, conduct symptoms like truancy, stealing, lying, and so forth, post-traumatic stress disorders, depression, and somatoform disorders. So these are the common mental health issues that the community or the population might go through when they are experiencing these kind of catastrophes or emergencies. Just a second, I'm holding here for a minute. Can I just know the time in there?
Two
2:16. It's up till 2:30, is it?
Yes.
Oh,
Yes.
Okay. It's just my time is here, the time here, so that's why I just asked you. Can I take a few minutes because it's just going on discussing things. Can I get anyone from my participants here who was a survivor or a person who has experienced a 2018 flood? Is there anyone who has gone through that particular situation? Can anyone volunteer? Anybody from the participants? Okay, that's all right. Just thought of having a little bit of, hands-on experience there. So this is all what we read. We have not experienced, a lot of us haven't gone through all these things. But somebody who has actually gone through might be able to, like, narrate it a little bit better more. That's why I just thought of having a look, but that's all right. So now I'm just going to the next thing, the resilience factors. So up till now, we were just explaining about what a disaster is and what are the types of disasters and what could be the general impact. And we just saw some literature support explaining what impacts actually these wars had on the communities. And then we saw what could be the general impact on the mental health. We just saw the phases of human reactions to a catastrophe. We saw the common mental health disorders that can happen in adults and both in children. Okay, now how do we overcome these kind of stressors, which is not at all an easy job, but still, if the community has some characteristics, it would be easy for them to come back to normal, to go with the normal. Okay, so here are some resilience factors that the literature reports that would be helpful and assisting the communities to come back to their normal, the old normal, not old normal, the new normal actually. So that would, sometimes it wouldn't be rebuilt, it wouldn't be possible to rebuild it to the pre-existing condition, but still adjusting to their new normal. The first one is the cohesiveness of the community. That was very evident in the 2018 flood. Though we believed people in Kerala are kind of divided and we are going more selfish or we are more focusing on our own needs. But when the flood hit, we could see people coming out openly, voluntarily, helping out each other, right? Everybody who sat inside the house were at one point out ready to help. So the cohesiveness of the community. Whereas in case of a civil war or where there is an internal conflict, just as I was explaining in Sudan, it is a conflict between their armed forces, government, and the other political parties. So the divide is within the country. So you can just imagine how they would be able to help each other. Instead of helping, that would be more kind of hatred and more kind of other emotions coming in. So once you stand united, the way you can cope is a lot better. So the cohesiveness of the community and the community resources available. So the pre-existing facilities that the community has a huge impact on how you're going to get over these kind of catastrophes. If you are already equipped, if you have enough resources and supply available, the impact would be a lot lesser. Okay, so that is the availability of community resources and the extent of displacement. If you don't have to move a lot of people to wide geographical areas, just in case of the flood that we had, you didn't have to go far, a lot far to rehabilitate people. Now, coming to a war in Sudan or a war in Ukraine, you can imagine the displacement that the population had. It was not even within their own country because their country was not any more safe to the population, right? So people started displacing into different countries, right? People started going into neighboring countries, other countries that offered them help. Literally, I've seen here people coming from these kind of African countries as refugees and other countries, lots of Ukrainians. Ireland has provided facilities and housing and accommodation for a lot of people once they come into a mental health care facility. See, I'm talking far away from the actual place where this disaster has happened. But still, see, my service as a mental health nurse has been affected because I get a lot of people who doesn't even able to communicate because this is an English speaking country. So they are moved from their own place to a different country. They have trouble with language. Their food habits are different. Their culture is different. Culture shock. A lot of things comes in place here. See, that is a totally different aspect of nursing, a transcultural nursing coming into it when it came to the aspect of displacement. See, because it is affecting the world globally. Okay, so that is another thing. So the extent of displacement that these communities are experiencing, and then the amount of social support and network that these countries are getting, or the community, the affected community is getting. Okay, and then their preserved family system and support, and then the altruistic behavior of community leaders. So just imagine when they fight for power, sometimes they might not consider their own people. They might not have these kind of altruistic behaviors. Is it? So the kind of altruism, the what do you say, your intention to help others, to go out and reach out to others. If the leaders doesn't have such kind of behaviors, that still will have a huge impact on the affected community. And minimal materialistic needs. If the affected area can manage their own basic needs and things, the need for additional support there is minimal. So again, the comeback would be much easier, and the religious faith and spirituality. So these are the common resilience factors that could help the communities in coming back to their new normal. So that is all about today's session. That is what I am supposed to be talking about today. So we just had a basic look at what a disaster is, what are the impact that a disaster can have on the affected community, what could be the repercussions on the mental health and the existing healthcare system, and how people would be experiencing it, what could be their reactions to disasters, and what could be the common mental health problems and the resilience factors. So that's the end of my presentation. Hope I did justice to the topic which is given to me. Anybody from the participants to add on to this? Because you are all professionals having experience in all these areas. So anybody would like to share their experience, or if any immediate queries, you will have a session towards the end of it. So in case if you want, I think I have another 5 minutes more to go. Maybe one question or something if somebody would like to come in.
ബെസി മൈക്ക് ഓഫ് ആണ്, പറയണ കേൾക്കണില്ല.
Sorry. Okay, so I can see lots of reactions here. Hope I made it clear. Hope it was useful for all the participants. And I take this opportunity once again, just before winding up, I'm back. Family, I was so grateful. I recently had a visit to Carmel when I was back home. It's more happy when you're with your own people, when you're with in your own family. So I express my heartfelt gratitude to Sister Prabha and Sister Ranjita. Sister has been in discussions with me about a webinar from long time, and maybe this is the time that God has made for it. Thanks a lot, and thanks a lot for all people who did the technical support. And Marin and Ansu, those who are in constant touch with me, I express my gratitude to them both as well. And I can see Sister Prabha's boys, they're actively coming forward to help. Thanks to them, to all the organizers, all my colleagues. Thanks a lot. So I'll just hand it over to the next person there, next presenter. Thank you.
Thank you so much. Thank you so much for your inspiring and informative session regarding the mental health during catastrophe. As nearly everyone affected experiences the psychological distress, the topic discussed is very appreciated. The insights you shared were highly valuable. We are genuinely grateful for significant dedication you showed in preparing and delivering this webinar. Knowing your schedule is full, it's crystal clear you prioritize sharing this knowledge with us, and that effort has truly made a difference in our webinar. Thank you, ma'am. Thank you so much. Our next speaker is Dr. Sebi Paul, an expertise and scholar in psychiatric nursing from National Forensic Mental Health Services, Dublin, Ireland. Currently, she is a registered psychiatric nurse, completed her bachelor degree of Masters of Science in Mental Health Nursing from Manipal University, Manipal. In addition, she did her philosophy in doctorate in mental health nursing from National Consortium for PhD in Nursing by Indian Nursing Council and affiliated to Rajiv Gandhi University of Health Sciences, Bangalore, Karnataka. She have finished a variety of certificate programs, including certificate program in young adults guidance and counseling from KUHAS, certificate program in management from Manipal Institute of Management, Manipal. She is recently awarded as membership of Faculty of Nursing and Midwifery by Royal College of Surgeons, Ireland. She has nearly 10 years of teaching experience and 5 years of clinical practice. She has many publications in the peer-reviewed journal. Currently, she is working as enhanced mental health nurse in National Forensic Mental Health Services for trade and pursuing graduate certificate in health professions education from University College, Dublin. We are pleased to welcome Dr. Sebi Paul, an expert who will be addressing the topic challenges on mental health with our international audience.
Thanks, Ansu, for that great introduction. So we will be moving on to the session. So today, the session I will be dealing with is mental health nurses' challenges for disaster response. So incidents and disasters, they are sudden, unpredictable, unexpected occurrences that often happens without warning. During disasters, there is an imbalance between the needs and the available resources. We were listening to the previous speaker talking about the impact of disasters and catastrophes. So during the disaster, there is imbalance between the needs and the available resources, leading to physical, material, economical, and environmental damages surpasses society's existing capacity. As a crucial member of healthcare team in all phases of disaster risk management, nurses can play a vital role in reduction of risk, complications, and casualties of disasters through education, management, leadership, counseling, support, guidance, and research. However, nurses face unique challenges in disasters that may not experience in their daily practice, which can make it harder for them to deal with disasters efficiently. So, see, in regular practice, we may not be dealing with all these stresses what we experience during the time of disaster where the society itself is unstable and we don't have enough resources to support people, we will find it difficult to prioritize things, and we may end up developing some symptoms of psychological distress. We may end up having anxiety, depression. See, maybe our families are also involved in the disaster. So the challenges faced by the nurses working in disaster response is numerous. So I was searching for literatures. There are very limited literatures regarding the challenges, but still I could manage to get few. So based on the researches available, I'm just presenting what are the existing challenges faced by nurses during disaster response. So coming to the challenges faced by nurses during disaster management. So the first one is diverse nursing conditions during disaster. So during disaster, nurses experience diverse and different roles compared to routine situations. They face an increase in the number of patients and require a much broader level of care and resources. So maybe in a day-to-day clinical practice, we will be getting specified number of patients and we will be dealing with their needs. Whereas coming to disaster, we are focusing on mass casualties, people suffering from mental health issues related to catastrophes or disasters. So nurses experience prolonged presence in the work environment, sudden change of work routines, and find themselves in an unfamiliar environment. Additionally, nurses do not know when the situation will return to normal, and providing care requires a quick response, which increases their vulnerability in the work environment. So usually when we care for patients, you know how long the patient will be in our care and what would be the plan for the patient's care and treatment. But in this condition, what happens is that the situation is completely unpredictable and we are not able to predict how long we are going to give care to the patient. So these diverse nursing conditions during disasters put nurses under stress, and that act as a significant challenge during the management of disaster. So coming to the next point, that is confusion and uncertainty during disasters. Lack of information and uncertainty regarding how to treat and care for patients. See, disaster is a sudden thing that happens in the community. So we may not be having adequate information regarding how to go forward. So these are unexpected situations. So people or the nurses will have confusion of the work environment and the chaos and crowding and presence of contradictory information about how to provide care during disasters resulted in feeling of confusion and worry. So once you are confused and you are uncertain about what you're going to do, so that will put people under pressure. So that can also be a significant challenge during disaster response. Coming to the third point, that is unknown end of disasters. So see, if you consider a war, the previous speaker was talking about the war in Ukraine and the war in Palestine. So see, the disaster, we can't predict when it's going to end. And we will be getting patients or people who need help throughout the period of disaster. So the nature of the disaster makes it difficult to predict their duration and how they will end. So it is unclear how to accelerate and improve care. The unknown duration and process of disasters cause anxiety and fatigue and lead some nurses to leave their job. See, like in my workplace, I have heard my colleagues talking about what do you say? There was time when we had a huge ice fall in the country and people were not able to move to their home from the workplace. And during that time, many nurses got stuck in their hospital. They were not able to commute to their houses. And they had a tough time, but they had to give care to their patients. See, and they were not sure when this is going to end. So many people used to share that experience and they were totally stuck. So, see, once you are in a disaster situation, that will, of course, create anxiety and fatigue among people who are working, and that will lead to some nurses to leave their job because they can't cope with these kind of stresses. The next point is intensifying cognitive and psychological impact of job during disasters. See, we all can work under a normal work pressure. We are all used to it because we work in a clinical setting usually, and we will be having the daily stressors and hassles that's happening always, and we are learned to manage such kind of stressors. But during the disasters, these kind of cognitive and psychological stressors are intensified. So we are not prepared to face that because it happened all on a sudden. We were not expecting that thing to happen. So nurses' physical and mental vulnerability in workplace is amplified during disasters. And the other significant thing is you will be hearing, as mental health nurses, you will be hearing loads of problems, personal problems of the patients that will be emotionally overwhelming for the nurses who are also human beings, who may be mothers or who may be daughters or who may be parents. So you will have all those emotions within yourself, and these stories from the patients will intensify your emotions. So that can lead to nurses experiencing irritability, difficulty in sleeping, intrusive thoughts, reduced activity levels, emotional numbness, psychological reactions, memory impairment, and post-traumatic stress disorders, even among nurses who are practicing during the time of disasters. Additionally, they often care for people infected with contagious disease, leading to fear of infecting themselves and their families. So, we all know about the story of Sister Linny, who got infected while caring for patient who has Nipah. So, and she lost her life while caring for patients infected with communicable diseases. So, when, like, especially in case of COVID-19 and all, if you see, most of us, when we worked in the clinical setting, caring for patients having COVID-19, most of us had this fear whether I will be getting the disease, whether I will be transmitting this disease to my family and my loved ones. See, all these things will, of course, affect the psychological well-being of the nurses who are working during the time of disasters. So even it is natural calamities or any kind of communicable diseases. So intensifying cognitive and psychological impact of job during disasters is a significant challenge that is faced by nurses during disaster response. Coming to the next one, that is inappropriate interactive platform during disasters. So during disasters, nurses must communicate with healthcare team members, clients, and their families. As a result, effective communication becomes more complex and challenging. See, first of all, you will be dealing with people experiencing lots of trauma, stress, grief reactions, depression. Okay, so, and you have to communicate with their family members as well, who will be worried about their family member being affected by the disaster. So as a nurse, we will be communicating with different people, having different mental state, different psychological distress. So it is very difficult for us to communicate effectively. So as a result, effective communication become more complex and challenging. And as we were talking before, see, in case of refugees and all, see, we do often get people who are affected with war or natural calamities as refugees in our service. So when we get such patients, we have to communicate with them as well as their family members who may not be with them while receiving care. So what we used to do is we usually avail the help of people who can translate their language into English. So we always use the help of interpreters to communicate with such patients. So communication is a very difficult thing during the time of disasters. So we do get many patients. I recently had a patient in my service who was from Ukraine, and she was not well versed in English, and it was very difficult for us to communicate. And we always had an interpreter number, and being a secure setting where we work at the moment, none of the people from outside can enter into the high secure unit. So what we do is we make a phone call to the interpreter while the patient is talking to the nurse, and they will be helping us to translate what they say in their own language. So nurses may struggle with choosing right words and phrases to provide information, empathizing with clients, and gaining their trust in disaster conditions because they already are in distress. So we should be very careful in using the terminologies, and we may not be empathizing in a right way. So we should be extremely careful about the communication and the words which we use while communicating with the patient, considering the language barrier as well. Additionally, the lack of time and emotional imbalances can lead to inappropriate interaction with healthcare team, clients, and their companions. Managing interaction is a very stressful task. So that is what is inappropriate interactive platforms during disasters, communication with the patient, their relatives, and also to the team members that makes the process a bit difficult and challenging. Coming to the next point, that's controlling emotions inappropriately as a factor in unfavorable interaction. So nurses face emotions and psychological changes when working in intense situations during disasters. So these challenges can manifest as anger, sadness, anxiety, mood disorders, and fear. See, we are all human beings. We are not gods. So we, of course, will have emotions, anxiety, sadness, and all, seeing people suffering from these conditions. And even maybe our family members or our loved ones are also involved, and we may not be able to be available for them at the same time while giving care to the patients under our care. So it's very usual to have these kind of emotions experienced by nurses. So nurses who experience these negative emotions were more likely to have conflict with their colleagues, managers, and companions. So improper control of emotions could prevent nurses from communicating effectively with others, leading to adverse interactions, physical as well as psychological injuries. So this is yet another challenge faced by nurses during disaster response. The other significant one is lack of continuous disaster risk management training for nurses. This is a very significant aspect or very significant challenge while managing disasters. Most of us are not well enough prepared, both psychologically and clinically, to manage a disaster situation. So, structured, effective, and continuous training is essential for improving the disaster risk management abilities. Lack of continuous training is considered as the most significant reason for failure to learn skills and acquire disaster risk management competencies. So, we should be able to prepare our nurses psychologically and clinically to face these kind of disaster situations. So coming to the next one, that is lack of development and implementation of evidence-based clinical guidelines. So if you search for the literatures, there are limited number of literatures available about to identify the, the gap in practice. So that lack of literatures to identify the gap in practice will lead to lack of development and implementation of evidence-based clinical guidelines. So we need to have good researches and we need to increase collaboration and coordination in order to implement evidence-based approaches during disasters. So coming to the next one, that is moral tension in complex disaster situations. So providing care during disaster presents challenging situations and ethical dilemmas are often unavoidable. For instance, the lack of equipments and medicine could make nurses feel ashamed, guilty, and uncomfortable. And decisions become difficult and sensitive as nurses struggle to allocate limited resources to benefit all patients equally. Moreover, nurses will find it difficult to prioritize whom should be given the priority first. So that is another moral tension or a dilemma faced by nurses during disaster response. So these are the most common challenges, and the other one is dilemma between personal health and sacrifice in nursing practice during disasters. This is yet another challenge faced by nurses, which is very significant. So nurses involved in disaster management faced physical, mental, psychological, and emotional risks when providing care during disasters, leading to moral tensions. Despite these risks, many nurses demonstrated their dedication by providing care in most difficult and critical disaster situations, even when their own safety was threatened. That's the case of Sister Lini, which all of us in Kerala are aware about. See, many nurses are ready to show that altruism to come out and help people when they are under a disaster response. So, and see, many people volunteer to come out and help as well. But if you think the other way around, many people will be very much concerned about the consequences, what they are going to have when they are involved in the disaster response. So it could be either way. Some people will show altruism and come out to help, whereas some people will think about quitting the practice because of their concern regarding these consequences which they are going to face. So, however, when faced with patients in urgent need of treatment, they might hesitate to continue working due to concerns about their own health. So that is a significant stress which is experienced by nurses or any other health professionals involved in the disaster response. The other one is dilemma between family responsibilities and voluntary work in nursing practice. See, when you are involved in a disaster response, you will be away from your families. That could be a very painful experience for nurses. So this is an unpleasant experience, and it is difficult to cope with changes in their family dynamics due to their absence. So see, the nurses or any other healthcare professionals involved in disaster response, they may be a family person, they may have a child who is dependent on them, they may have elderly parents who are dependent on them, maybe the whole family may be on their shoulder. So when they are involved in the disaster response, at the same time, they will be worried about their family, and they will be worried whether they're safe during the current social situation. So that causes significant stress among the healthcare professionals. As a result, family was a major concern for nurses, and it significantly reduced their willingness to work in unconventional conditions such as disasters. So that is another significant challenge experienced by nurses during disaster response. See, these are the common challenges experienced by nurses. And once if you identify the challenges, we should have some ways to manage them as well. So when I was searching for the literature, mostly I was able to get qualitative researches than quantitative ones when I was searching for the challenges experienced by nurses and what could be the measures which we can adopt to manage these challenges. So a journal which I was reading, which assessed the nurses' preparedness for disaster response, a particular study which was conducted in Hong Kong among nurses who were involved in disaster response among varying countries, practicing in varying countries. It showed 50% of them were prepared, and their stress, anxiety, their coping abilities, their year of experience, all these things significantly contributed to their psychological preparedness during disaster response. So, as we saw what could be the possible challenges faced by nurses during disaster response, we will see what all things we can do to prepare nurses to practice effectively during disaster response. So coming to overcoming challenges in nursing disaster preparedness and response. So the first one could be education and training. So improving disaster nursing locally and worldwide requires a multifaceted approach, starting with enhancing nurses' understanding of core competency domains. So the clinical skills as well as the psychological preparedness should be focused when we are training or educating nurses for managing disaster response. So integrating these domains into training and disaster drills help reinforce practical skills, ensuring efficient and effective response in real-life disaster situations. So practicing disaster preparedness drills and training the nurses and other healthcare professionals about how to manage disasters and what could be the psychological impact of disasters and what kind of people they will be dealing with. This would surely help nurses to be prepared and skilled enough to manage people during disaster response. Coming to the next one, that is research and development in disaster nursing. So as I said, there is a significant gap which we can see in identifying the challenges which are faced by the healthcare professionals during disasters. So once you have enough research studies to identify the challenges, we can develop strategies to overcome these challenges. So research and development are critical for advancing disaster nursing, and they generate evidence-based knowledge that guides clinical practice. By involving nurses in research focused on competencies studies become more relevant and applicable as they are rooted in real world experiences. See, as I said, most of the studies which we get are qualitative studies. So these qualitative studies really give a clear explanation about the lived-in experiences of the nurses or healthcare professionals who are clearly involved in the disaster response. So when we get a first-hand evidence from people, so that is actually very much relevant and it will be applicable in the real world experiences because they already survived that phase of disaster response and they were actively involved in the disaster response and they know what difficulties they faced during the disaster response and they will have better suggestions to say about what additional things could be added on to the existing plan and what things should be added to the training module of nurses for disaster preparedness. So research and development in disaster nursing is a significant aspect to be taken care of to overcome these challenges experienced by the nurses and healthcare professionals during disaster response. Coming to the next one, that is policy and organizational support. Key strategies include formalizing relationship between nursing staff and disaster organizations, which is essential for seamless communication and coordination during large-scale emergencies. So, the nurses should have effective relationship with the disaster organization so that the disaster response can be coordinated effectively and implemented effectively. So, implementing robust hospital policies that promote disaster preparedness through regular drills and training can significantly enhance the readiness of healthcare facilities. But then, coming to the natural calamities and the wars and all, see, again, question comes whether the hospitals really exist because the previous studies which was showed during previous presentation, you can see that 67% of the hospitals were destroyed. But still, as a hospital, it's always good to have a robust hospital policy that promote disaster preparedness through regular drills and training of the nurses and healthcare professionals for disaster response. So coming to the technology advancements, the integration of technological advancements presents significant opportunity to revolutionize disaster nursing, impacting education, access to specialized care, and the efficiency of healthcare response during emergencies. See, here comes this is mostly like significant in mental health nursing practice, again towards the end of the disaster phases when people need help from mental health professionals. There are various telecommunication strategies and various online models and platforms which we can apply for giving support, helplines, online supports. Those things again comes into action when people are in need. So see, we can see even in the educational settings, you can see the change that happened after COVID-19. See, in the educational setting, we were mainly focusing on one-to-one teaching, especially in Indian setting, we were focusing on face-to-face teaching and one-to-one sessions and all those things. But when the COVID hit the globe, see, we started using the technologies for taking classes and all these things. Similarly, for managing people having psychological distress during disaster, these technological advancements will come into action and that will help nurses and healthcare professionals to deliver effective support for people suffering during disasters. So the technological advancements become a boon again in case of disaster response, which could, if it is used effectively during disaster response. So that is what is the use of technological advancements during disaster response. And coming to the psychological preparedness and support. So this is the another thing which I was talking about when I was discussing about the challenges faced by nurses during disaster response. See, psychological preparedness and support play a vital role in disaster nursing, contribute to the well-being and resilience of healthcare professionals and impacted communities. Disaster is a thing that happens in an unpredictable way. So we can't predict when it's going to come. So if you are prepared psychologically and you are mentally and psychologically strong, then only you can contribute effectively during disaster response. So psychological preparedness and support is a key factor that help nurses or any other healthcare professionals to work effectively during disaster response. So say example, implementing strategies like HOPE model, proactive psychological interventions, flexible support, and including mental health provisions in disaster preparedness plan can effectively address nurses' emotional and psychological needs during emergencies. So it's a good thing that I have seen in my workplace in case of a loss of a colleague. So they usually have a support system in place. So I have seen, like, if one of our close colleague is died or is no more, and the people who are close to that person who are at work will be suffering psychologically. So we have a helpline, so we can contact them and we can have an open chat with them. We can ventilate our feeling to that support team during such kind of stressors. So similarly, such kind of proactive psychological interventions and flexible support for the nurses or healthcare professionals working during disaster response, that's a great thing that any nurses or healthcare professionals can avail when they are at stress. So the HOPE model for disaster is nothing but it's a framework emphasizing holistic health, assessment, immediate response, professional adaptation, and recovery. So this is a key factor which we should always take into consideration when we prepare nurses or any other healthcare professionals for involving in disaster response. So that is what is psychological preparedness and support. And see, that is preparing nurses psychologically or mentally to face the disaster response. The other key skill is role-specific preparedness. See, as a mental health nurse, we are going to deal with lots of psychological distress, depression, anxiety, post-traumatic stress disorders, see, stress-induced psychotic symptoms or whatever it is. So as psychiatric nurses, we should be prepared enough to face these kind of patients, and we should be prepared enough to give support to people suffering from psychological distress. Whereas if you consider a general nurse working in a clinical setting or an emergency department, the role-specific preparedness should be entirely different, where we should be training them more about triaging people, how to prioritize people, how to manage with limited resources which are available during disasters. So it depends on the role which the nurse performed during disaster management. It could be different for different specialization based on their role specifications. So role specific preparedness is a vital aspect of disaster preparedness and in disaster nursing practice. So if you train people based on their role specification to work during disasters, that's a great thing that can help nurses to overcome the challenges which they face during disaster response. Hope the slides are moving and you're able to hear me properly. Can anyone just tell me, am I audible and my slides are moving and the explanation is clear?
Yes, ma'am.
Yes, madam. It is crystal clear.
Thanks a lot. Yeah, just to have a check in between because it's all technology again. Interruptions can happen. So I don't want that to affect the presentation. So thanks a lot. So coming to the interpersonal collaboration and cultural competence. So this is what is seen especially during the late phases of disaster response. As Bessie was clearly mentioned about Ireland having lots of refugees from different countries like Ukraine, Palestine, and all these things. See, interpersonal collaboration and cultural aspects are too much involved in these later phases of disaster response, where people comes as refugees to a different country, they are facing a cultural shock, they have difficulty in using the languages which is used by the country they are in as refugees. See, that's a whole lot for them to face over the psychological distress that they are experiencing as a result of disaster itself. So interpersonal collaboration and cultural competence are crucial for effective disaster nursing, fostering a comprehensive and inclusive approach to emergency response. See, this is where the transcultural aspect of nursing comes into action. See, when we prepare nurses, we should prepare people to work in a transcultural situation, like where we have to deal with people from different countries or different cultures. So the nurses, especially mental health nurses, should be prepared enough to manage these cultural and language barriers or the situational barriers what they have. So interprofessional collaboration involves coordinated effort among different healthcare professionals, enhancing communication, reducing redundancies because they will be already feeling that they are inadequate, and ensuring a more efficient and cohesive response to emergencies. So as I said before, like using a translator or an interpreter to communicate with the patient who is from a different cultural environment or from a different country who speaks different language. So these interpersonal collaboration and cultural competencies and inculcating these things into nurses who are working in disaster response is a key aspect of disaster preparedness. So these are mostly the things what we can do in facing these challenges during disaster response. So hope I have made the concept clear. I made the concept clear. So today we discussed about the challenges faced by nurses during disaster response and also what could be the measures which we can adopt to face these challenges so that we can deliver effective disaster response. So you have enough time. I think I finished nearly 20 minutes ahead of time. So now if you want to have any queries, you can have it. And before I proceed, just a second. Okay, so before I proceed to the question and answer session, I would like to take this opportunity to thank Sister Prabha and Sister Ranjita for giving me an opportunity to deliver a session during this international conference. And again, Marin and Ansu for their support always from the phase of planning till the implementation phase. You did an incredible job. I really appreciate your effort. And see, when me and Bessie, we take time to spend time with you, it's merely a thankful response from our side for all the help and support we got from the institution. So we will be always grateful to you for all the help and support you were giving throughout, even for our doctoral studies when we were pursuing. We got enough support from the management and the faculty and everyone there. So we consider ourselves as a part of that institution, and we will remain always indebted to all of you. So thanks a lot. Thank you so much. And if you have any queries, you can
Thank you.
proceed.
Thank
And
Thank you,
Bessie will
Bessie.
be also available here.
Thank you so much for your very much helpful it was. So we are appreciating your help and your presence. Thank you.
Thank you, sister.
That was a fantastic and highly impactful presentation. Your practical life experiences in the field of challenges of mental health is remarkable. We recognize that preparing a webinar like this requires extensive work, and your willingness to go above and beyond to deliver such a comprehensive and insightful session, despite your very busy commitments, is something we are deeply appreciated. Thank you so much, ma'am. We have come to the end of the webinar. Finally, I now invite Mrs. Tina, lecturer, Carmel College of Nursing, to propose the vote of thanks.
Good evening to all the distinguished guests, speakers, faculty, students, and participants. As we conclude this immensely important and successful webinar on access to service, mental health in catastrophes and emergencies held on October 4, 2025. It is my distinct honor and privilege to deliver vote of thanks. The breadth and depth of knowledge shared today have been truly exceptional, highlighting the critical nature of mental health support in times in crisis. We begins by expressing our profound gratitude to the guiding behind this event, Dr. Sister Prabhagiri CMC, Principal, Carmel College of Nursing. Sister, your beliefs in this concept and theme, alongside your esteemed support and review, made this entire endeavor possible. Thank you, Sister, for your vision and leadership. A heartfelt thank you is to Sister Ranjita, HOD of Mental Health Nursing Department. Sister, your dedication and tireless efforts and detailed organizational work were crucial. This webinar could simply not have been happened without you. Thank you for your commitment. We are deeply grateful to our panel subject matters experts who shared their valuable times and expertise. We express our sincere gratitude to Dr. Moses Onwuchekwa, Emergency Medicinal Physician, USA. Sir, given a wonderful explanation regarding organizational, community, and individual role in mental health crisis. Also officially unveiling the theme and providing a vital clinical context from a frontline. Thank you, sir. A special note of thanks to Dr. Bessie Paul and Dr. Sebi Paul from RPN National Forensic Mental Health Service, Ireland. Your detailed information regarding mental health during catastrophes and the inherent challenges in assessing service provide a crucial global perspective. Thank you, ma'am. To Dr. Ashwati Anand, clinical psychologist, Carmel Hospital. Thank you, ma'am, for your brilliant explanation of psychological dynamics of disaster response. Your insight into human behavior during crisis were truly illuminating. Thank you, ma'am. Our own faculty from Carmel College of Nursing played a vital role in grounding this discussion with modern consideration and practical application. Thank you to Ms. Marin Joseph, Assistant Professor, for your concise and relevant explanation of the modern considerations related to our theme. Thank you, ma'am. We thank Ms. Asha Lakshmi, Associate Professor, for shedding light on the indispensable role in community in mental health support during emergencies. Thank you, ma'am. And finally, our gratitude to Dr. Diva George, Professor, for expertly detailing the necessary role of healthcare system in this context. Thank you, ma'am. No events of this scale can smoothly run without impeccable coordination. Our sincere thanks to Ms. Ansu Maliyekel, the moderator of the webinar. Your seamless support of the speakers and hosts and your engaging interactions with the audience ensured this entire program flowed without a hinge. Thank you, ma'am, for being an anchor of today's events. Last but certainly not least, a special thanks to every participants from our nation, moreover from USA, UK, UAE and Ireland who joined us today. Your actively presence and enthusiasm are what truly make a webinar successful and validating the importance of this topic. We also thanks my colleagues and our dedicated sixth semester students who provided a valuable support and enthusiasm, helping us successfully organizing every aspect of this day. We live today with a deeper understanding of the complexities of mental health in disaster and renewed commitment to improving access to these critical service. Thank you all once again.
Dear delegates, kindly check the chat box for evaluation. Please complete the feedback in the link provided in the chat box. Everyone, please fill the feedback form. Then your e-certificates will be given within a 1 week.
Now, it's time to acknowledge the valuable contribution of our respected moderator. We sincerely appreciate your efforts in guiding today's section smoothly and meaningfully. I now invite our esteemed moderator, Mrs. Ansu Maliyegal, to kindly receive a memento as a token of love and appreciation from the organizing committee. Thank you for your time, commitment, and dedication in making this international webinar a great success. Thank you.
Delegates, you may share your feedback. Anyone from the group? Thank you so much. A token of love and appreciation is now given to the organizers by Dr. Sister Prabha Grace. I welcome the organizers.
So you've done a great job. We are very much appreciating your effort and all the effort you have taken to maintain this one. Okay, thank you. Congratulations. So thank you so much for your effort. Okay, congratulations.